heart attack or stroke can sneak upon you without any forewarning. About a year ago, as I was leaving the Taco Bell Arena here in Boise, Idaho, after a concert, as I was leaving, I was seeing this gentleman with his daughter, and he all of a sudden stopped and just started to lean against the fence. And I asked him, if he was doing okay. And he said, "Yeah, I'm fine. I'm perfectly fine." And I was walking a little bit further, and all of a sudden I see him, down onto the ground, just sitting down. And I was asking the daughter, "Is your father doing okay?" And said, "Yeah, he's just having a little bit of hard time breathing." So as he was going through this process, I then turned around and started to walk towards him. And all of a sudden, as I was talking to him, I was just kind of want to see if he had any kind of clarity, and then he was responding. He just all of a sudden just fell down and started to convulse. And checking his pulse and seeing that there's pretty much no pulse whatsoever, I started to do then chest compressions and CPR on him. And this gentleman, he had no indication whatsoever that he was going to have a heart attack. But all of a sudden, he was enjoying his time with his daughter, and he was on the ground having a heart attack. And just obviously it was the most traumatizing event probably for his daughter and also for himself. So we're able then to get the ambulance, and they took him to the hospital, and his life was saved. So this is something, when you have blocked arteries, you don't know when this kind of event is going to take place. So it is very important to be acting ahead of time instead of waiting for an event like this to take place. And there are a lot of things that you can do in order to prevent these type of events from taking place, such as lifestyle. What are you eating? What are you eating things that are going to clog up the arteries? Are you eating inflammatory foods? Also, you have the technique that I was talking about, chelation therapy. It's amazing in cleaning up the arteries and giving you then a fresh start, so that if you have any concern or any worry about that there is an issue with your cardiovascular system, then this is a fantastic way of cleaning things up to make sure that blood will then supply the heart properly, or the brains if you're nervous about any kind of stroke or a history of stroke, or if you have had a poor lifestyle all your life and you're concerned that there might be an issue that things are blocked in some way. This gentleman, he travels out of the country quite a bit. Obviously, he was very grateful, had his life saved. And as he was traveling, coming back from the country that he was coming back to the United States, another person on that plane then had a heart attack, and he did not survive. So it just, as I mentioned, it is this silent killer that you really have no clue what is going on inside of you. And it is taking more lives than any kind of health issue that is out there. So it is important to really address it very well. Chelation therapy, it has a 60-year history of safety and effectiveness, and over those 6 decades, actually more than 1 million patients have undergone chelation therapy for a wide range of circulatory problems. Here's a couple of other patients, what they've said. 2 years ago, I had a stroke, and my doctor said there was a good chance I wouldn't speak, walk, or use my arm again. After chelation, I now walk and exercise almost normally, and often speak in front of large groups of people. I'm off Coumadin and Lasix, my cholesterol dropped 100 points, and we travel. Chelation therapy has given me my life back. Another person said, my blood pressure was high as 220 over 165 with severe angina, loss of sight in one eye, and I was headed for bypass surgery. I had heard of chelation and chose to try it instead of the bypass surgery. Now my blood pressure holds steady at a normal level of 120 over 78. The angina has gone after only the 5th treatment, and my vision is better than ever. I have a healthy and active life ahead of me. So these are the kind of effects that you can see by cleaning out your arteries. For instance, your eyes, you have very tiny little blood vessels. So If they get blocked, then the eye is not going to receive the nutrition that it needs in order to function properly. So through chelation therapy, you can then start to remove all that cholesterol and all that plaque, all that buildup in the eye. It's not really the cholesterol number that is the issue. You have somebody that can have a number of 300 plus in cholesterol and their arteries are perfectly fine. Then you can have somebody where the cholesterol level, when you get the blood test, it's 100, but they're just filled with plaque all over. So to look at your level of cholesterol and then determine whether you're healthy or not through that number, it really has no correlation. What really has the impact is whether your blood vessels are inflamed or not. And if they're inflamed, you're going to have that buildup of plaque. And the chelation therapy, I'll talk a little bit more about how that then can help to remove that inflammation and also remove that plaque.